5, 4, 3, 2, 1. Good morning and welcome to vaccineangel.com. Today, we have the good opportunity, the excellent opportunity of having three medical doctors speaking with us. These three doctors, Dr. Siegel, Dr. Benson, and Dr. Kaminski, are all affiliated with Yale University. And the very first thing to do here, transcending saying good morning, is asking, do you all have coffee?
Yeah. Yes.
Okay, so starting with Dr. Siegel, can you tell us something about yourself and where you come from and what you're doing today?
Sure. So my name is Dr. Mark Siegel. I am a pulmonary and critical care physician. My clinical time is spent to a great extent in the medical intensive care unit of Yale New Haven Hospital. I hail originally from New York, but I have been on the faculty at Yale since 1995. I am also the program director for the traditional internal medicine residency at Yale, so I spend quite a bit of my time teaching and leading and mentoring medical trainees.
And I noticed that you're also, transcending your medical skills. You're also trying to, as articulately as you possibly can, communicate what the situation is to the general public.
That's correct. As Dr. Kaminski and I have discussed a lot recently, we view it as our responsibility as physicians to make sure that the public understands the nature of illness and what can be done to prevent it and what needs to be done on a societal level to prevent patients from getting sick.
Well, Dr. Siegel, let me again commend, I'll do it now, I'll probably do it 10 times more, your social activism in terms of getting the word out. Dr. Kaminski, good morning.
Hi, good morning. Thanks for inviting me. I'm a pulmonologist by training. I was born and raised in Israel. Came to the US probably 20 years ago or a little bit more. I'm a physician scientist, so I do a lot of research trying to understand mechanisms of disease. My main interests are pulmonary fibrosis and lung injury, and the current pandemic definitely fed into the thing we study. I'm also an academic leader. I'm the chief of pulmonary critical care and sleep medicine at Yale, which means that I oversee the work of outstanding physicians that know about disease way more than I know. And many of the frontline physicians basically are within the two programs that Mark and I represent. I also have some national standing, and I was the previous president of the Association of Pulmonary Critical Care and Sleep Medicine Division Chiefs. That represents a lot. Everything that I'll say today does not represent the institutions that I work in. I do think that physicians and scientists have been too quiet in our society. As scientists, we see mechanisms. As physicians, we see the results of sometimes failed policies. And it's much better to prevent failure than to deal with the outcomes of the failure.
Dr. Kaminski, I can't articulate enough how much of a true pleasure it is to have you here today to help educate and provide awareness in regards to the present situation regarding COVID. And also I want to commend you for having an espresso machine. One day I might take you up on having a cup of that good stuff. Sure. Dr. Benson, good morning. How are you?
Hi, good morning. Thank you so much for having me. Glad to be here. So I'm Dr. Jemma Benson. I am a graduate of the Traditional Internal Medicine residency at Yale, and I'm currently one of the chief residents, which means that I split my time both as an attending physician at the VA and also at Yale New Haven Hospital, as well as providing education and administrative responsibilities to the residency, including currently helping manage our response to this wave of the pandemic. I've been on the front lines of the COVID pandemic since I was a second-year resident in the spring of 2020, when I spent much of that spring working in the COVID ICU. I've been involved in vaccine advocacy and outreach, done a number of educational projects related to motivational interviewing, talking with people who have concerns about the vaccine and effective communication strategies, as well as going door to door in one of our communities here in Fairhaven, talking to people about the vaccines and trying to communicate their importance. And yeah, I'm thrilled, and I am going to be an infectious disease physician. I am planning on starting fellowship at Boston Medical Center in July.
Again, really a pleasure. I mean, a true, sincere pleasure. Dr. Siegel, did she miss anything in terms of being frontline?
She's a superstar. Okay, and if you want to know how to take care of a really complicated patient, Jemma is the doctor you want to call.
Okay.
Thanks, Dr. Siegel. It means a lot.
Well, doctors, again, thank you for your time and thank you for your effort here today to educate and answer some of the questions that we have regarding COVID and regarding vaccines, regarding testing kits, regarding mask mandates, vaccine mandates. So let me start with Dr. Kaminski with a very simple, basic question. What is COVID?
One, it's not that simple, but it is a viral disease, right? And actually, I think Dr. Benson, as a future ID physician, is better than I. I can speak about what it does to the lung, but it is a viral disease. You know, we live with viruses. One of the things that people tend to forget is all human history, people lived with infections. And pandemics and epidemics destroyed empires. You know, the Byzantine Empire and others. This is part of human history. What we see now is in the last 100 years or last 50 years, we have gotten really good at dealing with infections. The improvement in life expectancy, you know, cardiologists do an amazing job and cancer docs are doing an amazing job, but the major success we had was vaccinations and antibiotics. And potentially also improving the social conditions of people.
Well,
And-
one of the things I would like to address, and I think one of the most critical things we need to address is misinformation versus fact, misinformation versus science. I know personally that there is a tremendous amount of misinformation coming in out of Russia, actually coming out of St. Petersburg, Russian intelligence. It's called the Internet Research Agency, which has been exposed by the CIA, the NSA, and if you do a search for Internet Research Agency, you'll find it. And only in the last few months has the United States government, Facebook and Twitter, have they begun to start to remove some of these perfectly created fake American profiles that have been spreading all kinds of misinformation, like, you know, vaccines will turn you into a giraffe, you can't make love anymore, you'll have autism, you'll develop a third eye, whatever it might be. Just pure utter nonsense. But unfortunately, a lot of that nonsense does get out to people, and some people grab it, and it creates a lot of doubt in terms of, well, are the vaccines safe? So before I ask, are the vaccines safe? Let me ask Dr. Benson, what is the difference between the flu and COVID, or is it the same thing?
Sure. So the flu and COVID are, to start, different viruses. So they are fundamentally different entities, although, you know, they're both quite infectious, but COVID much, much more so. I think one thing I would just say about COVID is it's really a multi-organ system disease. We see the way that it can cause blood clots all over the body. We see the way that it, you know, we're starting to understand more about the long-term effects that what we describe as long COVID. And so, you know, there's so much still to be understood about COVID, but it's the mortality rate, the infectivity are just much, much higher with COVID. I don't know if Dr. Kaminski or Dr. Siegel have anything to add.
It has, is COVID a more lethal virus than the flu?
Yeah, I think that Dr. Benson is making an important point, because one of the sources of misinformation has been this statement that you hear people make sometimes, that it's just the flu. So first of all, that's inaccurate. As Dr. Benson said, it's not the flu, it's a distinct virus. But more importantly, we've got lulled into a sense of security over many years because people, by and large, can recover from the flu. And although the flu actually kills tens of thousands of people every year, most people could feel comfortable that they could withstand an influenza infection. And in fact, there's been a vaccine available for flu for everybody for several years as well, which was not to any great extent a source of controversy. But the SARS-CoV-2 virus is a brand new virus. The human population of our world has never seen it before. And so when a virus comes on the scene that humans have not been exposed to, they become particularly vulnerable to its effects because there's a total lack of immunity in the human population. So not only is the virus dangerous, our bodies don't know how to respond to it. And that's what's led to all the widespread death and disability and suffering that we've seen since the end of 2019. This points to why vaccines are so essential, because since we lack immunity, you need to get your immunity one way or another so that if you do happen to get infected, you can fight it. So if you get a vaccine, you can actually create the immunity in your body so that if you do get exposed to the virus, you either won't get infected or you will get a relatively minor infection. And that's been our greatest source of protection. But that's the key. They're both viruses, but this is a brand new one. And that's why it's been so lethal.
So if I'm correct, the flu is not COVID.
Correct.
The flu is not COVID. These are completely different viruses. I just want to highlight this exactly the same concept that Dr. Benson and Dr. Siegel said. There's two elements to it. One is we've never seen it, so we don't have protections. Flu has lived with humans for literally thousands of years, right? And still it kills a lot of people. And if we wouldn't have an annual vaccine, our hospitals would have looked pretty bad, by the way. But we do have vaccines, we do have medications, we have, but it is still a different disease. Flu is, the difference is that when COVID infects you, and again, the virus is changing, so something that I'm saying today may be wrong tomorrow, but at least with the previous variants, what we know is that the virus infects you and sort of lingers a little bit in your airways and then connects to receptors that are in specific cells in the lung and activates the whole, almost like in a nuclear explosion of infection. Right? And this causes all the mess we see in your blood vessels, in your brain, in your lung.
You're talking about COVID now, not the flu.
Yeah, this is COVID. Yeah, COVID. Right. So it's a different virus. It activates actually different mechanisms of inflammation. Dr. Akiko Iwasaki at Yale has done a lot of work on this. Actually, our group has even helped her a little bit, but showing that there's a different, how would we call it, a different immune program that is activated by COVID. And that's why it's not, it hits the lungs, but it hits many other organs, the blood vessels, the brain, others. And I think this is the reason why we're seeing sort of this long COVID, this strange syndrome. And this is another reason to get vaccinated. So people say, okay, maybe the virus now is less dangerous than it was a few months ago. But we literally don't know what it will do to you in a year.
So in 2019, 2020, we had COVID. I like to call it COVID classic, like Coke classic. Then we had mutations, variants. Delta, I believe, was one of the first, and Omicron, which I believe is the dominant one. Can we discuss this in regards? What is the difference between COVID classic and COVID's variant, Delta, and COVID Omicron?
Maybe we can have the future infectious disease physician help us with that, Dr. Benson.
Sure. Please feel free to jump in, Dr. Siegel and Dr. Kaminski. So, the Delta overall, the clinical presentation was pretty similar to what I like the term COVID classic. It was significantly more infectious. And so Delta posed a real threat. As does Omicron. So one of the sort of main differences we're starting to understand, so you all may have heard that Omicron is milder, but what does that actually mean? And that's still being understood and worked out. What we know so far is from data from the UK and South Africa is that hospitalizations and deaths seem to be lower, but we have to remember that Omicron is encountering a population that now has a certain degree of immunity. And so, there have been some studies that have shown that Omicron perhaps is more of an upper respiratory syndrome, as opposed to giving you symptoms like congestion, sore throat, as opposed to the real, with what you're calling COVID classic, that we saw this profound impact on the lungs. It's all really early to say, though, and we're looking at a lot of this in a population that's encountering Omicron we've only had for a little, around a month now, a little less being so widespread. So it's hard to know. And regardless, the fact that Omicron is so infectious means so many more people are getting infected, that even if the hospitalization and severe illness rate is lower, it can still exceed what we've seen in the prior iterations of COVID. And so it's still a real threat, despite this comment that it's milder. Dr. Siegel, Dr. Kaminski, do you have anything to add?
Yeah, thank you. That was perfect. So maybe I can supplement this by bringing everybody to the front lines. We have never been busier. So in the midst of this Omicron threat, our hospitals are overwhelmed. And they're overwhelmed for a number of reasons, but let's start with the basic concept. If Omicron is half as likely, and I'm just making these numbers up, but it'll make the point. If Omicron is half as likely to put somebody in the hospital, but twice as likely to infect somebody, you still have the same number of people in the hospital. So Omicron is far more contagious. So for any individual person, they may be less likely to get seriously ill. But the fact is that many, many more people are getting infected. We've seen numbers like 20% of the entire state, maybe more now, are actually infected right now. We've got lots of hospital staff getting infected, residents getting infected. So I think we need to get away from this notion that Omicron is not dangerous. It's causing a lot of death and destruction. The other thing that we need to emphasize is that when patients come to the hospital with any form of COVID, they actually take up beds and make it hard for other people to get the care they need. So if you come to the emergency department of any hospital right now with a stroke or with a heart attack, okay, or with a flare of your diabetes, you're going to have to compete with all the COVID patients who are crowding at the hospital. Our hospital census is the highest it's ever been. And so I think one of the most destructive things that's being said out there is this minimalization of the importance of Omicron. Okay, it is making people sick. It is making the hospitals crowded. It is making the staff sick. And it's making it very difficult for us to do the job that we know we want to do at the highest possible level. I was just down in the ICU over New Year's weekend, and most of my patients had COVID. I don't know if they had Omicron. It's impossible to say in any individual case unless you do, sequencing of the virus. But it was as busy a COVID effort as I've made since March of 2020.
And I think I think there's a problem, when my sister says I had a mild disease, that means nothing, right? Didn't affect her life. When we say you had a mild disease, it means it's not gonna kill you or make you unable to work in the future. But the mild disease could look really bad, right? And actually, many of the vaccines we use now are aimed to prevent mild diseases. You know, we're looking at, in pulmonary, we're looking at RSV vaccines for children to prevent asthma, future asthma. These don't even cause, you know, this is not a severe disease. Here, we have a disease that does cause hospitalization, does cause symptoms. And I'm not sure, I do think that Omicron presents a different type of disease. You know, I think it behaves differently. We see less, definitely less of the lower lung infection. But that doesn't mean that people are not going to be sick, miss work, potentially have long-term impacts. And
Well, let me ask you a question. My understanding is that the main mechanism of how COVID works, whether it's COVID, the original COVID, or as I say, COVID classic, or COVID Delta, or COVID Omicron, and all the other mutations and variants of the original COVID, that the main mechanism is the clotting of blood. Is this correct?
You know, that's, you know, as Dr. Benson was saying before, it does a multitude of things. So one of the big problems is clotting of blood. You know, we've seen patients who've had strokes. We've seen patients who've had pulmonary emboli, which is a clot that travels to the lungs that can cause a life-threatening problem. But there's also an inflammatory response that we see, which is connected to the clotting, but it's not just clotting. It's basically the body's response to an infection is to fight the infection to get rid of it. But for reasons that we don't completely understand, that inflammatory response is so exuberant that it's like what Dr. Kaminski said before, it's like a nuclear explosion going off in your body. So it also depends on when in the course of the disease you're talking about. What's happened classically is when patients get any form of COVID, the early symptoms are largely like a bad cold or like a bad virus. And then for some reason, once you get into it about a week or so, there is this acceleration of the response to the virus, which brings people into the hospital. So the fevers get very high, the breathing gets very difficult. You know, people start to have low oxygen levels. And this is the sort of thing that brings people to medical attention. It's not the first day that you get sick. It's for reasons we don't totally understand, several days into it, where things take a
So
turn.
we're basically looking at two different mechanisms. I'm sure, I think if I understand you correctly, there are more, but we're looking at clotting and we're looking at inflammation.
let me actually clarify a little bit. What viruses do, they can't really do anything. They need to enter a cell, take over its machinery. A cell is the smallest unit of the organ that does its function. And the virus doesn't really care about us. The only thing it wants to take the machinery of the cell and replicate. So there's more viruses. That's the only job of the virus. And the virus does it in different ways, right? So some viruses are quiet, like herpes virus. You could get infected when you're 2 years old and you'll have it and then does nothing to you. Maybe it reactivates every now and then, but most of your life, you're going to be healthy. So that's a really smart virus, right? Coronaviruses have a mechanism, and they haven't lived with us that long. The mechanism is they they basically have a way to bind the cell surface molecule, and then they enter, and then they do their thing. But they have, let's say, they have not figured out a way to live good and not kill us, right? So at this stage, some of the things they do are really bad for us. So when the virus goes into the cell and starts activating its own machinery, it activates inflammation, it kills the cells, it hurts the function of the organ. Now this is evolving, right? Because that's the way evolution works. So there's mutations and organisms work. I know that this is complicated, but the virus enters a cell, and the type of cell it enters dictates a lot of the disease. But what we've learned now that, as Dr. Siegel has said, that after this initial phase of infection, something happens in the body. There's and we think, and again, based on mostly on Dr. Iwasaki's, and those of you on Twitter follow her on virus immunity. She's brilliant. She'll understand, explain to you everything. Basically, that the virus not only activates a program that makes the virus replicate, it actually activates an inflammatory response. And this hurts everything. And it hurts the cells that line your blood vessels and cause clotting. And it hurts your lungs, and it may hurt, it hurts some cells that cause you to lose smell. And potentially, the brain fog, we don't know how it comes, but this is in some ways, systemic disease. We do think that Omicron, the same changes that make it more infectious, actually make it a little bit milder because it doesn't cause this nuclear explosion, right?
So if I understand correctly, COVID, corona, has basically an explosive impact on the body as compared to flu, which does not have an explosive
It does not have, exactly. It doesn't have the same machinery, right?
So again, COVID is not the flu. You can't compare the two.
I don't want to minimize the flu. We have a
Right.
lot of patients who get very sick from it, and it can cause heart manifestations, it can cause brain manifestations. But the extent to which the coronavirus affects the whole body is like nothing I've ever seen before.
Wow. Wow.
I would
Okay.
just, excuse me, I would just add that the patients that you may see on the news who are getting intubated and connected to a ventilator machine and really sick in the ICU, most of those patients are having this really profound inflammatory response that Dr. Kaminski and Dr. Siegel are describing. And they basically make the lungs so inflamed that they can't use oxygen properly anymore. And that's really what we're seeing. Those patients are having the really profound inflammatory response. That's what's making them critically ill.
Okay. What do the three of you believe is really the most important issue or issues facing the general public today in regards to COVID?
I'd like to invite Dr. Benson to start that.
Yeah, so there's so many. I think I would start essentially with this discussion that we've had a little bit of this question of whether Omicron is milder. I had a friend who isn't in healthcare call me last night and said, I have friends who are saying we're all just going to get it. What's the problem with that? And that mindset, I think, is potentially incredibly dangerous. And so she and I had a conversation, she's really responsible, thoughtful, she's boosted, which is really important, which I hope we talk about the importance of boosters. But there's many things, given just how infectious Omicron is, she could be walking down the street, we think at this point, be in a store with just a surgical mask on and potentially transmit the virus to someone who is significantly at higher risk. So someone who's unvaccinated or immunocompromised. The other piece is how infectious this is, what it's doing to our systems and infrastructure to be able to support and take care of patients. We're seeing just a huge number of people who aren't able to work because they've been infected with this, and we need as many hands on deck as possible to keep our healthcare systems functioning, to keep our economy functioning. And so those are really major risks. So I would say, as we've talked about, the kind of downplaying of Omicron is a significant concern. I think the second is that we have a long way to go in terms of vaccination. We still need, as many people to get boosted as possible. And now we have increasingly good data that getting boosted does help protect against Omicron in a way that the first two doses don't, that your body often needs a little bit of that extra push to really protect you against Omicron. And then, the lack of mask mandates, which is something I'll let Dr. Siegel talk about because he's been really an incredible
We're going to get to that.
so I would say those things, the the sort of pervasive idea that this is milder and therefore it's maybe okay just to get infected and get it over with. I think, the significant way we have to go in terms of getting our population vaccinated, and then a lack of mask mandates at this point.
Dr. Benson, I've heard that too. I've heard from a lot of young people, oh, I'll get the Omicron, big deal. It's supposed to be mild, and I'll just take some aspirin and I'm done with it. And what I'm hearing, I believe, from you three good doctors, you three good medical doctors from Yale, is perhaps the word milder is not the appropriate adjective. It's not the proper description of what Omicron is, that Omicron can create a tremendous amount of damage to your body, not just immediately, but also long-term. Whether it's COVID, whether it's Delta, whether it's Omicron, all three present a real threat to your survival. Am I correct?
Yeah, I think that Dr. Benson said something that I think needs to be highlighted too. This is about being responsible to our neighbors. An individual patient, an individual person might indeed have a very mild infection. If you've gotten 3 vaccinations and you get COVID, you yourself probably don't have too much to worry about. I don't want to say that absolutely, because some people get sicker than you'd expect, but it's what happens to other people. Okay, what happens when you walk into the store, as Dr. Benson said. It's what happens when you are spending time with somebody who has cancer, or somebody who made the unfortunate choice not to get vaccinated. It's what happens when our hospital staff gets sick and can't come to work because they have to go in isolation. And so I think that one of the failings that we've seen throughout this pandemic is this notion that we are responsible for our neighbors, this idea that it's all about us. And I think if we can transmit any message today, it's that we're all in this together. And so our need to wear masks, our need to get vaccinated, our needs to socially distance is to save our country. It's to save our society, our economy, our hospitals, for all the people who have other issues that they're dealing with. It's way beyond an issue of how do I protect myself.
So I was in a hotel lobby, I believe it was last week, and I saw someone not wearing a mask. And normally speaking, I would try to be polite and say, do you need a mask? Instead of being confrontational, being helpful. But I had basically had it on that particular day, and I said, can you please put a mask on? Person turned around and looked at me and said, excuse me, why don't you mind your own business? I don't tell you what to do with your body. Don't tell me what to do with mine. She was speaking to the wrong person. I then turned around and looked at her and I said, excuse me, it is my business. I don't need you spreading COVID to other people and to me. You don't know if I'm high risk. You don't know what my immune system is. So please. And she didn't really have a response to that. But by all means, that we have to get off this egocentric, well, it's my body, it's my rights, it's my liberty. My rights, my liberty, my freedom, that's not coming from the United States of America. That's coming out of Moscow. That's coming out of Russian intelligence. These sound bites are coming through to people in the United States through Russian intelligence. Also, China is doing a bit, and so is Iran, in terms of providing these really wonderfully created fake profiles on Facebook and Twitter, of which the government and Facebook and Twitter are right now trying to delete. So when I see these profiles saying, oh, it's a hoax, and then 3 weeks later, that person who was saying COVID is a hoax is all of a sudden now in an ICU bed with a tube inserted into his body, and he's about to pass away, and he's saying, this is not a hoax. It shouldn't get to that point, which brings me to the stress that the hospital system right now is suffering from. Can we discuss that a bit? I mean, we have this thing called COVID. We have a pandemic. We have people getting infected right now at rates we've never seen before, I believe, in the history of this country. Is our hospital system able to cope with it? Are we falling down? And if we are suffering, what is the answer?
So I'll say something. there's actually a dashboard that you could look at hospital systems at risk. I'm glad to say that I think Connecticut is one of the only 2 states that actually is not at risk of failing, right? Which is both optimistic, but also scary, because I know what's going on in our hospitals, right? So if we're not at risk of failing, I don't want to think what's going on in Indiana, right? Which is actually failing. I actually think this is a public health crisis and emergency. And that's what, when some physicians like myself criticize the previous administration for their response to the pandemic, people said it's politics. It's not. I'm now extremely critical of our response to the pandemic again. There's no messaging. One of the things that really helped hospitals in the previous surge was actually the lockdown. The lockdown doesn't necessarily help you because you prevent infection. It does help prevent infection, but it prevents motor vehicle accidents. So last week in Connecticut, if people wanted to move a patient, let's say that the medical intensive care unit is full, you say, okay, there's other places you could put them in, like the surgical. But remember, this was a holiday weekend, which is a peak in accidents. So units all across the state, and actually all across the Northeast, were full with people who had broken legs and other things, right? And some of them critically ill, some of them what we call mildly ill, which is months of being sick, right? If somebody who broke an ankle, no, that's a mild injury, right? So the problem with the lack of action is that our hospitals are really full with sick. The other thing that people underappreciate, American healthcare systems are under stress without the pandemic. In some ways, we are victims of our own success. The population lives longer. We keep people with cancers, with immune conditions. We give them good life. They live in the community, but they need care. And our healthcare systems didn't grow the same way and didn't get spread and provide equal access to everybody they should. So that means that hospitals always have to compensate for it. So we started really stressed. And adding infections is really, so I think that people underestimate, they look at the number when they look at the dashboard and say, oh, in Connecticut, there's 80, the hospitals are only 85% of capacity. But that doesn't mean that we should get to 100%. Because much of our capacity, one is we have different capacity. Some of it is for children, some of it is for different diseases. The other thing, we're really not built to work at 100%.
One quick question: Are children getting COVID?
Yeah.
What
Children are
percentage?
I just want to expand upon something Dr. Kaminski said. So, as an intensive care physician, one of the principles I live by is not to get anywhere near a disaster. You want to keep everything completely under control. And what isn't illustrated by the 85% is the number of respiratory therapists and nurses and physicians who are out ill right now, or the number who have quit, because they just can't take it anymore. And so you may have an open bed, but you may have a respiratory therapist who is doing their best to take care of as many patients as they possibly can at one time. So I would see it almost like, say you're in a boat on the Niagara River headed for the falls. You may not have gone over the falls yet, but you know it's coming. So the fact that we're not drowning today, doesn't mean that you're not about to head for a calamity. Let me give one other example for how this affects medical care. So I also see pulmonary patients in the outpatient setting. And as I'm sure most of you might imagine, one of my biggest tools is a stethoscope. And when I have a patient who has asthma, I listen to their lungs to see if they're wheezing. Well, because we're in the middle of this pandemic and we need to minimize contact, we had to change all our patient visits this week to televisits, which is terrible for pulmonary. We do the best we can, But that's not the kind of care you want. If a patient is telling me they're having trouble breathing, it could be heart failure, it could be asthma, it could be any of a number of things, but I can't examine them because right now we can't see them in the office. So there are all these ways that the system is starting to spring holes and starting to leak that are already going on. And when you hear physicians say things that are reassuring, they're trying to strike a balance, but you don't want people to panic because we are doing our best to take care of our patients. Our doctors and nurses and therapists and others are heroes. But it would also be wrong to say that there aren't people who are suffering because of the downstream effects of this pandemic, because of how crowded we are. This issue with the accidents on the highway, it's everything. Okay, this is not the time to get sick and have to be in the hospital.
I have read that.
Joel, I want to say one more thing about this. So when people speak about elective procedures being postponed, this is not luxury. If somebody needs to get a colonoscopy to find cancer, delaying it a few months could mean life, right? If somebody, like our elective procedures, bronchoscopies, we don't do them for healthy people, right? Usually it's somebody who has a small nodule. It may be cancer. We're not, so, and that's all over. So there is this perception that the hospital can postpone elective procedures, but luxury in hospitals is nobody gets a surgery for fun, right? So, and this is a huge impact on our healthcare. Even somebody who needs a knee replacement, it's true, they can wait a month.
I have read that several states right now have called out the National Guard, the Air National Guard, their medical corps to come in to assist several hospitals throughout the United States, that the hospitals are now facing two different challenges. One is a logistical one in terms of we just don't have any more ICU beds. That's one. And the second challenge is our staff, our hospital workers, good doctors like yourselves, nurses, other healthcare workers have been working 24/7, are stressed out, are exhausted. And I have heard many doctors speaking out, pleading with those who have not been vaccinated, because also according to what I have read, and you could tell me if it's correct or not correct, the vast majority of people taking up hospital beds are the unvaccinated. Is that correct?
That's correct. I'd just like to make one more point, building on what Dr. Siegel and Dr. Kaminski said. In March and April of 2020, we heard this phrase "flatten the curve" a lot. And what that meant was people taking reasonable precautions to protect the healthcare system, to not overwhelm hospitals. And we are not hearing that this time around. I took care of patients, as I said, in the COVID ICU the whole spring of the first wave, and then was on our medical wards in the summer of 2020. And I look back on that time, I have never seen general medicine patients as sick as I did on the floors in the summer of 2020. And this is anecdotal in my experience, but we could look back and trace their illness to delays in care the whole spring of March and April and May, that they weren't being seen in person by a physician. I took care of patients over telemedicine for many months. I was working in a really vulnerable community with a lot of essential workers. And I think, the care that I'm able to provide over video, it's the best that I can do. But then a lot of times, if a patient urgently needs a set of vital signs, then you're stuck with the same thing of sending them to an emergency department that's already overwhelmed. And so it's really just suboptimal and devastating. And I would just add the impact on healthcare workers. We know across the country, healthcare workers are leaving in decent numbers. And the exhaustion and the stories that I talk every day with our residents, many of whom their entire residency has been taking care of COVID patients, our third-year residents, they're exhausted and incredibly disheartened. They talk about the challenges of caring for people who chose not to get vaccinated, experiencing, patients being angry with them when they even suggest it, knowing that it could save their life. And our residents are exhausted. and we need help. We need people to take reasonable precautions and get vaccinated so that we can, have this next generation of physicians grow and learn and be excited about medicine and to continue their careers for a long time.
So
But I would
Dr.
say-
Benson, when an anti-vaxxer says, well, why should I get vaccinated? I mean, there's one shot and this doesn't work. A second shot doesn't work. A third shot. Now the Israelis are talking about a fourth shot. How do you address that?
Yeah, so I think when talking with people, so first of all, the data in terms of what helps to get people vaccinated is convincing and most definitive that vaccine mandates are the most effective tool in terms of increasing vaccination levels across the board. In terms of in individual encounters,
So do vaccines work?
that of course, vaccines work. 2 vaccines is better than none, 3 is better than 2, and that in terms of Omicron, and that's what we know right
Is that
now.
because whatever vaccine you get will be related to the mothership, to classic COVID? I mean, it'll still have an effect. The variants are just an aberration of the original. So there's still going to be some sort of protection. Am I correct?
So yes, so the COVID vaccines are incredibly protective against what you've been calling COVID classic and the Delta variant with 2 doses. We see some of that immunity wane for Omicron, but there's new data out in the past couple of weeks. The 3rd dose, a booster shot, can really reduce the risk of hospitalization and death from Omicron as well. So it's vital that people get vaccinated.
So how do we protect ourselves from getting COVID today?
I will pass that one over to Dr. Siegel.
Thank you. It's a multi-pronged approach. Vaccines are most important. If you want to protect yourself, as Dr. Benson said, 1's better than none, 2's better than 1, 3's better than 2. We need to arm ourselves. Number 2 is masks. Okay, we know that masks prevent spread. It makes it less likely that the mask wearer will inhale the virus. It makes it less likely that the mask wearer will exhale the virus. In an ideal world, especially with the virus being as infectious as it is right now, high quality N95 or equivalent is probably the best and most secure way. It would be wonderful if we had N95s for everybody, and I would strongly endorse that if we could. But it's that combination of factors that we've been hearing from the start: vaccination, social distancing, and mask wearing is the way to protect ourselves and to protect others.
Why
Dr.
don't we
Siegel, may I ask? Sorry.
Why don't we have a mask mandate in Connecticut?
Well, we should. I think we've been very clear about that. I have heard Governor Lamont say that he wants to leave it up to individual towns and individual people to do the right thing. He has made what I perceive as very weak recommendations that people consider wearing masks. But the problem is that if you don't have a mandate, you also have complete confusion. Individual towns with different rules, business owners who don't feel empowered to tell their customers what they need them to do. People are confused about what's important, because I think when the governor says that he doesn't want to institute mandates, what people hear is that masks are not important, and nothing could be further from the truth. So I would hope at some point that Governor Lamont will issue a mask mandate that sends a strong message to everybody in our state that this is what we need to do to protect ourselves and protect each other. And I firmly endorse that recommendation. And I hope at some point the governor will come around.
Is there a difference in the masks which are being used? Is there a difference between a cloth mask and a N95 or a KN95?
Yeah.
Of course.
I would never see a patient with COVID with anything less than an N95 or equivalent. And the reason is that they are made of the right kind of material that minimizes the risk of inhaling the virus. And also the N95s have a seal around your face, which prevents entry. So they're the best. Unfortunately, not everybody has N95s at this point. So my recommendation would be to wear any mask you can get a handle on. Surgical masks are better than cloth masks.
Dr. Siegel,
If I may take a different
Wait,
tack here, though, because I think we're preaching to the choir, right? Everybody here is probably boosted and wears N95s. And I'm just wondering, how do you reach out? I mean, it doesn't look like we're going to change any minds anytime soon. So given the status of our state right now, so all of us agree here, how do we reach out and change the minds of those that don't agree? Or how do we come to an end of this while dealing with people that are of a different opinion? Like, what's the way forward, really, besides just another mask mandate? I mean, is this the best we can do? Get boosted, wear an N95 and do the best you can? Is there another path?
Well, first of all, I think the fact that we're here today is a testament to the things that we can do. I don't know if we can convince Governor Lamont to change his policies. He may be beyond convincing at this point. That doesn't mean we won't try. But there are a lot of people listening to us. I think that people in the state of Connecticut are learning what it takes to protect themselves and protect others. We're sending the message out strong and clear that you should get vaccinated, that you should wear a mask. And I think that if we can't rely upon the governor of our state to do what needs to be done, then we need to mobilize other forces to make it happen.
The other thing that's really important to highlight is this is a dynamic, right? So, and that's why I think physicians and scientists and citizens have to be, and nurses and any other healthcare worker have to be vocal. As Joel alluded to, some other forces that may send out false fake news and false misinformation. There's also business interests. And it's really important that the public have a voice. The governor 4 weeks ago attended, 3.5 weeks ago, when Omicron was already happening, attended a dinner with the Connecticut Restaurant Association. There were over 1,100 people unmasked. In that meeting, he didn't say, I wish all of you wore masks. Here is I'm wearing my masks. He said, I'm not going to impose any more restrictions. I actually think that this is a strong indictment of his policy. And I was a supporter. I still think that he's doing a lot of good things, but in this, it was extremely wrong. And it's important to make this point. People always say, let's move on. There were errors made in the past. Let's move on. Let's look at the future. The truth is, if we don't have an honest look at what was made wrong, we'll never fix it. And from my point of view, when people have asked me the last few weeks, why are you tweeting or why are you public? I actually am speaking to patients in the community, people in the community that just want to support for their position. I want to empower people to wear masks. There's now a mask, the state is spending millions of dollars now providing masks and kits. But there's no real empowerment of how people should use them, right? So I want, if somebody in the community has gotten a mask, I want them to say, oh, Dr. Siegel actually said in the newspaper, it's good to use it. So even if there's no mask mandate, people feel a little bit more empowered to use it. I do think we have to push and more, because there's another thing, which is what Dr. Benson alluded to, which is flattening the curve. Even now, we're probably close to the peak. Probably today, they will announce that hospitals in New Haven or in Connecticut have reached the peak of May 2020. We will continue rising. So protecting people now, even one person by the other, raising the voice is really important. The other thing is our politicians should know that they'll hear from us, even if we are registered to the party that they support, right? So when Mayor Justin Ellicott did impose a mask mandate in New Haven and went in the streets of Westville, I actually saw them, or whatever, asking business owners to maintain the mask mandates. He made the effort. He didn't say, oh, they're not going to listen to me. And he also didn't send the police to give them a fine. He actually made the important. If the governor would have done the same thing, Connecticut is a good state. People actually listen to you.
I would like to clarify something here with the three good doctors that we have here. Dr. Siegel, Dr. Kaminski, and Dr. Benson. Are you speaking as Democrats, or are you speaking as Republicans, or are you speaking as medical doctors who do not have a political agenda?
Man, I'm not a fan of that question for what it's worth, but go ahead. It's like, why, this is our problem.
I'm
Why
here-
do we?
No political agenda. That's no
Exactly,
partisan.
exactly. I mean, this should be about science. This should not be, it's unfortunate. This is where we are in this country, and this is part of the reason. I don't agree. We can all be on the side of science and against certain principles. Like why put them in the spot?
I completely agree. I think that it's actually what hurt us is the politicization. And if you look all over the world, you will see that in
Agreed.
some places, it's one side against, and the other one is pro, and the other places, so politics have messed us up here,
To that point, when we say follow the science, I certainly have a problem with mixed messages from the CDC right from the beginning. In March of 2020, they said, well, masks won't really help you. And then, it was, if you're vaccinated, maybe you can not wear a mask. And now it was, boosters are only for 65 and up. And then the government says, no, everybody can get, the governor says everybody can get it. And it's like, well, wait a minute, we either follow the science or we don't. And I feel like those messages have caused, it sows doubt. And we're seeing it again with the isolation guidelines. There's a lot of doubt again. And it's like, every few months, there's not a unified follow the science. This is what the science, it's always tempered with stuff.
Yeah, I'm comfortable addressing a couple of these issues. The first is to say unequivocally that Dr. Kaminski, Dr. Benson, and I are here as doctors. Okay? Our sole agenda is to save lives, nothing more. That's the end of that. The second is that the term "follow the science" is very misleading. Science, by definition, is self-corrective. So when people say things on any given day, we know as physicians that science may change. And it's one of the reasons doctors are so cautious when they make the statements that they make. And it's not as if scientists are always right. And so we have internal debates about conclusions that people draw all the time. And that's something that the public needs to know. But when Dr. Benson and Dr. Kaminski and I come on here today saying things without the shadow of a doubt, we do so because we're at the point where we know to nearly 100% probability what we're saying is true. Nobody's going to doubt us that the hospital is overwhelmed. We know enough about how the virus is spread and how important vaccines are. Millions of people have been vaccinated. Most of the people who are developing life-threatening illness right now are unvaccinated. Okay, that's not going to change. And so I think that when we talk about following the science, I think what would be a better thing to say is listen to responsible people who don't have an agenda, who are simply trying to keep the public safe, save the country, save lives. And this is what we're trying to do. And I wish that our government officials, I wish many of the people who are speaking out and confusing the public would just take a moment to breathe, reflect, okay, and come together and try to help the health of this country.
Governor Lamont of Connecticut has so far refused to implement a statewide mask mandate. And he feels that it's better for the individual towns and cities to make that decision. So that leads me to ask the question, is there some sort of invisible border that the towns and cities have to prevent COVID from coming into that town or leaving that town? Is that a proper, rational, and medically sound approach to leave it to the towns and cities? Or should there be a statewide mandate?
So I'll answer it a little bit different. In theory, and if we had really good real-time information, and when infections are not common, it makes sense that you'll have red, green, yellow places that, but even then I wouldn't leave it to the local government. I would just make it as basically a sliding scale. automated. The public health people should decide this, not the elected officials, right? And you could, in some ways, there were efforts to do it during the pandemic. It's just they never took on. I don't think, municipalities are so overworked now, exactly like the hospitals, right? They have to deal with the schools, with sick people, with their employees. It's unfair to put the responsibility on them. I also think the same thing is actually true for the state. I actually think, and I want to pick up on the issue of CDC, and I'll say it again, this hurts me to say, the CDC for me is, I admire these people. The contribution of the CDC to the health of the world is unbelievable. The last 2 years, but even before, because of reduction in funding and other things, haven't been the best. And we all need to have a sort of a reckoning, a public discussion, how we make the CDC better. How does it communicate with the diversity of populations that we have in our country in a simple way? The American Medical Association, I think the first time ever, came out with a very strong rebuke to the CDC today. This is beyond, there is a healthcare crisis and sick people. This is actually a crisis in the medical community. Because the problem is that we actually all agree what needs to be done, but the communication, the implementation has not been transparent, has not been good. So the CDC definitely needs a record, I don't know even how we call it. In Judaism, we call it a cheshbon nefesh. We need to look how we provide better public health to Americans. It's possible because we have amazing, brilliant people and tools. But there is an issue with the CDC, definitely with the communication. I do advise people to use common sense. If somebody tells you to jump out of a plane without a parachute, even if it's the CDC, don't do it. So the same thing with masks, use good masks, regardless if there's a mask mandate or not. And that's
I have one very quick question. Does COVID today pose a life and death risk to the general population? More so than anything else that we're witnessing right now?
Absolutely. It definitely does. But I think that we need to be clear about why it does. Because to any individual person who's been fully vaccinated, the likelihood of them getting sick from COVID is much less now than it ever was. But if you look at it on a population level, with so many people unvaccinated, with so many people flooding our hospitals, that the effect on the health of the general public is as bad as it's ever been. And that's what we need to focus on, okay? Get everybody vaccinated, get everybody wearing masks. And this is what we need to do to make the situation less dangerous. And I think what's frustrating and what Dr. Kaminski is saying is that our failure to institute common sense public health policies, like wearing masks in public, stopping indoor dining until the wave passes, vaccine mandates, all these sorts of things would bring this epidemic under control. And for whatever reason, I'm not a politician, there appears not to be a will to say what needs to be said. And all I can say is that I hope that we'll have more opportunities like the ones we had today to make this clear, simple, effective message and be able to do whatever we can to bring the pandemic under control.
My understanding as the executive director of Vaccine Angel and having worked as a journalist for more than 30 years is that life today begins with wearing a mask. Vaccine, important, critically important, but life today begins with wearing a mask because a mask is not evasive. We're not putting anything into your body, but wearing that mask will protect you, and that mask will protect the people around you, your family, your friends, the community. Doctors, do you agree with this?
Yeah, I would say if you're not vaccinated, when you're going to get your vaccine, wear a mask. And when you get vaccinated, continue wearing a mask. The mask is the protection, and a good quality mask is really important.
Should restaurants and bars be open?
not for indoor dining. You know, as I think you know, Joel, my wife is in the food industry. She's a professional chef, and so we really want to support our colleagues in the restaurant business. But right now, you should support them by takeout. All right, you should support them by going to outdoor dining, because we know the ventilation outdoors is safe. I would never eat indoors in a restaurant right now. It's one of the most dangerous things you could possibly do, to take your mask off with a bunch of strangers with a high likelihood that somebody else in that restaurant has COVID and the virus is circulating around and you're inhaling it while your mask is off. I hope that day will come to an end soon, but
Is
not
there
now.
a difference between today and a half year ago or a year ago? I mean, is it much more dangerous for me to go to Denny's, IHOP, and Ryan's Deli? Is it much more dangerous today than it was a half year ago?
Well, it's much more infectious, right? So if you're in a closed space with Omicron floating around, the likelihood of you becoming infected is much higher.
Yeah.
So in that sense, absolutely.
So 6
I would
feet.
also add- I would also add a difference between now and last June is that we know that Omicron has a much higher likelihood of breakthrough infections in the vaccinated. So, you know, getting your booster is a really important step. But last June, we were in a place where the recommendation was that if everyone was fully vaccinated 2 weeks post the second vaccine, you could gather unmasked, and that couldn't be further from the truth right now. I mean, we ask our residents to all wear N95s all day, and they're almost entirely, you know, they're all fully vaccinated. And so that's also a major difference from where we were last June.
So
Dr. Kaminski, I have a question from one of our moderators, and she's asking me to ask you, please. Where do we go from here?
to our basements to hide. No, no. No, but seriously, I think it's important to just sound the message. I had a call yesterday, a friend who is an airline attendant that was sick overseas, was still told to go to work, right? Because she had a negative rapid test, antigen test. Now, we know now that if you have respiratory symptoms, even if you have a rapid antigen test, you are probably 40 or 50% chance that you have COVID. That's been the data that we have, right? She had to go to work because it was told to her, you're negative. She wears a long transatlantic flight, then became positive here. That's very common now, right? So I think raising awareness that this is extremely infectious, that people have to wear a mask, and we need to keep sure politicians, we shouldn't give up on them. They're actually pretty good. Many of them want to do the good thing. We need to balance some of the other influences they get. So I think advocacy is really important. Keeping the vaccines, and I think keeping the pressure also on the CDC with other things. There's examples of countries that are doing it better or places that are doing it better. So we have to keep moving. The other thing, the reason that we spoke actually yesterday is because she was asking, can she go to the gym? Because she wanted to follow the CDC guidelines. Now she's 3 or 4 days without symptoms. And I said, I would not, out of responsibility to others, I would not follow the guidelines. I would do a test before I go out, even if I keep wearing a mask, because this virus is infective. And, you know, our government left us to our own. So we have to make our own decisions and be responsible and not infect, you know, the person next to us. So
Well, I hear Dr. Siegel saying, do not go to restaurants, do not go to bars today. Use takeout. Wait till the numbers get down. Wait till we are able to
Yes.
control the narrative on this infectious disease, which is affecting not just you and me, but our families, our friends, the entire community. It's going to be, and it is affecting our very, very economic and defense infrastructure. We have naval ships now that are not operating. We have bases that are looking at closing. We can't afford to have an infectious disease to weaken our economy or to weaken our our defense infrastructure. And along these lines, to say, well, businesses have to stay open. I believe, no, they don't. These businesses can stay open in terms of providing food for takeout, not people coming in and congregating. So that now leads me to another place where people congregate, schools.
Well, Joel, but
Do you-
before you
do
leave,
you
Joel,
advocate-
before you leave, Joel,
Go ahead.
I just want to say one thing about that. So one of the problems is that these restaurants are suffering, and I think we need to give them our business. I don't think any of us should come across as unsympathetic to what this means to workers and owners and things like that. If in my ideal world, we would provide them with financial support to make it through this difficult time. But it's also important that we have an off-ramp. I know from personal experience that both Dr. Kaminski and Dr. Benson love eating in restaurants, okay? I know that we love to get together with people and see each other's faces. We believe that the approach that we're advocating today will get us to that period faster, with more people alive and well.
Dr. Siegel,
I think
what if I
think-
go to that restaurant and I'm vaccinated?
Right now,
Right now.
it's like Russian roulette. That would
Because
be
I can get
incredibly
Omicron.
Yeah.
you if you're unvaccinated, we have no information to suggest that you will not get seriously ill. Okay, we know that if you are vaccinated, triple vaccinated, as Dr. Benson said before, the odds are that you individually will not get seriously ill. So I think it would be a very dangerous thing to do today.
Well, a lot of restaurants have a big sign that
I'm
says,
sorry.
if you must be vaccinated to come in. I believe that Governor Lamont and other governors are saying, if you're vaccinated, okay, fine. Or maybe we'll create a vaccine passport. What is your take on vaccine passports?
So on January 6th, 2022, no vaccine passport is going to help us, okay? Because there are these breakthrough infections and the numbers in our state are off the charts. In the not too distant future, my hope is that we will be able to open restaurants with vaccine passports so people can dine safely. But that depends on the numbers coming down, right? It depends on more people getting vaccinated. But it's something that I would look forward to perhaps a few weeks from now. If we're lucky, some people predict that Omicron will decrease in the next few weeks. So if our numbers go back to something more tolerable, then I do think that would be the path we can follow. We're just not there yet.
And I have two more questions. My second to last question is, if I feel symptomatic, what should I do? Oh, and by the way, and what would those symptoms be?
Let's have the infectious disease physician answer that, Dr. Benson.
Sure. So this is a call. I was on call for our residency last week. This is a call I got almost every day. And we're at a point of saying any symptom, you need to stay home and quarantine and you need to get tested as soon as possible. And so symptoms include, we go by all of what you refer to as the COVID classic. So all of those symptoms of loss of taste or smell, GI upset, fevers, those, we're seeing less in our boosted population, but are still characteristic of COVID. Any symptoms of cough, congestion, sore throat, you need to stay home, quarantine, and get tested.
So along those lines, if I have a sore throat, should I go to the ER room or should I wait a few days? Should I take a rapid test at home?
If you are feeling well, otherwise, you should not go to the ER with a sore throat. The ERs, are probably not the best place right now. They're incredibly overburdened, and you could get the same care elsewhere. Yes, you should take a rapid test if you can get it, or a PCR test, and just get tested as quickly as you can.
Are the
But
rapid home tests,
not recommend going to the ER.
are they accurate?
Yeah, they are not as sensitive as the PCR test. And when we use the term sensitive, it means that you can have COVID and have a negative rapid test. But if it's positive, you should assume that it is truly positive. So when we're using rapid tests, what we often recommend is that they be repeated. And if it's negative and you still have these upper respiratory symptoms, that you should still worry that you have COVID, and that would be the time to get the PCR test.
So
So
I want to highlight one point here, which is really important, which is why we tell people exactly don't go to the ER if you have mild symptoms. Try to get tested. There's a population, if you have a disease that puts you in high risk for a bad outcome. If you're immunosuppressed, getting drugs, cancers, I would encourage contacting the primary care physician. And if not, trying to escalate, and especially asking, are you eligible for therapies? Because we do have both oral pills and IV drugs that can reduce severity of disease. We don't have a lot of them in the state. I don't know if it's a few hundred doses, it's not millions. But if we can prevent unnecessary hospitalizations and severe disease and even death from, that's a big deal. So I still think that people who have risk factors for severe disease, even if boosters, have to be more careful than everybody else, really protect themselves, and then if they have symptoms, get tested as soon as possible, communicate, and be insistent, because sometimes the primary care physician is not aware that this medication is already available. This is so new, right? Maybe contact a city hotline or other things. But this is really important because this could save life. I did see there are other questions on, like, I think Kate is raising her hand, if you want to call on her.
Okay, but before I go to Kate, let me ask you one question, which is on a lot of people's minds, and that is, if I understand correctly, avoid going to restaurants and bars right now. Keep them open and use their takeout service. But how about schools? Should we be looking at remote learning? What's your take on this?
So Joel, if I can just interrupt, because that was actually my question.
Okay.
Thank you. So first of all, thank you all very much. My husband and I are vaccinated, boosted. Our children 5 and 8 are also vaccinated, and we're in Fairfield, but Fairfield has reduced mitigation. They've removed the contact tracing. If you are, had COVID, 5 days later, you can go back to school without a test. And they are wearing masks, but they're not at lunch and snack. We've chosen to send our children to school because we feel the mental health issues for all of us make sense. Is that something you agree with? We've also thought about keeping them home for a couple weeks and then sending them. Just curious to hear your thoughts on COVID in vaccinated children and the mental health versus the risks of COVID.
Kate, thank you. You've taken my question word for word.
Thank you. Thank you.
Yeah, these are really challenging questions, and I can just imagine the stress you and your husband must be feeling as you navigate this. So I think it's really important not to understate the impact that COVID has had on children, particularly younger children who can't reasonably learn remotely and really need the social of being in schools. And I think we need to resolve to do everything possible to get children into schools and to do so safely. So I think that barring something which is really going to prevent that from happening, like all the teachers getting sick, things like that, or we're hearing about school bus drivers getting sick. I think we should view children going to school the same way we view doctors going to the hospital. This is where they need to be. And in turn, I think we need to do everything possible to keep our children safe. And my worry is that we're not doing all of that. I think that we need to have clear messages about masks. There's a lot that can be done to improve ventilation. I'm not a parent of a young child, but I have a high schooler, and I asked her, are they opening the windows, for example, in the classroom? The answer is no, but we know that ventilation is essential. So I think there's much more that we can do to mitigate spread in schools, but I think we should do everything possible to keep them there. I think one of the really weird things about this pandemic is my daughter's school just went remote this week because there was an outbreak. So we're keeping the kids out of school, but people are still going to bars. And that makes absolutely no sense. So I would say let's find a way to get the kids into school and do it as safely as possible.
Before we start to sum up, Dr. Siegel, you've been very vocal in terms of calling for a statewide mask mandate. Do you still believe in advocating a statewide mask mandate in the state of Connecticut? And if you do, what is your message to Governor Lamont?
I absolutely support a statewide mask mandate. I think that the governor and others should look at the numbers and to see all the suffering that has occurred because we don't have a mandate. We have confusion with all the different towns having different rules. We have confusion from a muddled message, which makes it unclear to the average person whether masks are important or not. I am stupefied by the governor's explanation, which his spokesperson expressed in the last day or so, where he said something along the lines of, we don't have enough state police to enforce a mask mandate, as if Connecticut residents need police to tell them what the right thing to do is, as if that's the only thing between us and getting people to put their masks on. I think if our governor got up today and said, we need everybody to wear a mask, this is the rule, every town, every establishment in the state of Connecticut, we need people to wear masks, Connecticut residents will do the right thing. Will there be outliers? Of course there will. Okay, but we're looking for guidance, we're looking for leadership. And I think if he puts a mask mandate in place tomorrow, we'll start to see improvement in the situation in the state.
Dr. Siegel, the governor has mentioned at least twice. Take a look at New York. They have a mask mandate and it's not working. But now we have more cases of COVID in Connecticut than there are in New York. Was that a proper equation? Was that a proper analogy of what the governor had made in terms of, well, New York's not working, so mask mandates don't work? Do mask mandates work?
Yes, they work. Dr. Benson talked about bending the curve earlier today. That was how we did it. We had everybody wearing masks. And I think it's a real mistake to look at New York and draw that conclusion. Things would be infinitely worse in New York if they didn't have a mask mandate. The other thing about New York is that people are wearing masks. Okay, so proof, I think, that a mandate doesn't require a police state to make sure that people do the right thing. So I think that it is quite clear to me that a clear message with a mandate is what we need right now.
I would just
Closing comments now. Let me start with Dr. Kaminski.
Actually, Dr. Benson first. He was
Okay,
again.
ladies first.
I would just add that, anyone who doesn't think we need a mask mandate, I would encourage to take a walk through our ICU. Of course, that's not possible because we now have a new visitor restriction, which again means that people who are sick and suffering in our hospital due to the threat of Omicron can't be with their loved ones while they're in the hospital. But I would, I wish I could paint a picture of what it looks like to watch someone become critically ill from this disease. I personally have held iPads as people said goodbye to their loved ones over Zoom and had their final conversations with their families over Zoom, because that's what COVID does, is it causes horrible illness, separates people from their families. It causes long-lasting, both physical and psychological effects. And we see that people who've suffered from COVID, we see that in our healthcare workers who've been on the front lines. It's devastating. And if there's the simplest thing, putting a mask on can prevent so much of that suffering that we've all experienced for the past 2 years firsthand on the front lines. It's really, it's so simple. And I just really support everything that Dr. Siegel has done and is saying, because we need to, again, flatten the curve. We need to, again, reduce the number of hospitalizations right now and people who are critically ill.
Thank you, Dr. Benson. Dr. Kaminski?
So there's no doubt that the mask mandate is needed and was needed a month ago. I see a lot of comments about the schools in the chat, and I feel very strongly about it. I actually think that that's a failure. I think that kids should go to school, but I think the state should have had a plan a month ago. And then that plan should have included a remote option. Again, everybody, it's true. COVID and Omicron is really not that dangerous for kids. But even in our public schools and in our private schools, there's kids with asthma, there's kids with diabetes, there's kids who live with parents who are immunosuppressed. You should not put them in a situation that they're afraid to go to school. Kids who want to study, who want to learn, but now are anxious because they sit in a class that is less safe than possible. So I think that the state should have had a plan, which should have been maximize attendance of children in school. And this plan should have included partial restriction on restaurants, gyms, hair salons, a statewide mask mandate, and an option for remote learning for kids who may not be able to do it. The problem is now we hear this sort of heroic thing, all our kids are going to go to school, but there's no really good plan. In the New Haven area, the high schools now are having to go shorter because there's not enough bus drivers, right? So what's the point? Making the sort of the image of a functioning state, right? Presenting an image of a functioning state with a functioning education system, well, actually, it's completely dysfunctional. So I think the schools are important, but what's important is people on the school. Go out there, put an online petition, speak with your neighbors, send letters to the governor, send letters to the Department of Health, to the Department of Education. They actually notice this. It's really important that our citizenry be more active.
Well, I would like to say that they definitely notice it. When vaccineangel.com suggested having a petition, and we implemented a petition because we believe that Governor Lamont at one point during the pandemic was opening up restaurants and bars too quickly. All of a sudden, we had lost whatever funding that we were about to receive. There was, I believe, $26 million in federal funding for advocacy work, and that's what we do at Vaccine Angel. And all of a sudden, after we had created that petition, we were, bye-bye, you're not going to see any money from us. So again, I applaud the efforts that you good doctors are making in terms of speaking out and speaking the truth. Dr. Siegel.
So first of all, I want to thank you, Joel, and all the people in your organization for giving Dr. Benson and Dr. Kaminski and I this platform today. I want to close with something that Dr. Kaminski has said to me countless times. He's ringing in my ears. He says, keep it simple. And in fact, it is simple. If we're looking for an off-ramp here, wear your mask, get vaccinated, follow common sense public health measures, and we will get back to the life that we hope to regain. It's nothing more complicated than that. And so I hope we've been able to convey that message today.
Any other comments, doctors? I feel as though we have gone from A to Z. I'm sure we didn't address each and every question, and we haven't. And there will be time in future days for us to come together again and to address present situations as they arise a week from now, 2 weeks, because as we know, this is a science. We know that COVID changes, it mutates, and our adjustment to those changes, to these aberrations, will change as well. I cannot thank you, Dr. Siegel, Dr. Kaminski, and Dr. Benson for your good time, for your expertise and for your effort, not just in the hospitals and in the community, but for being here and getting the facts out, getting information which most people are having a hard time trying to secure. There's a lot of misinformation out there. I believe you've addressed a lot of the misinformation. You've addressed a lot of the facts, and you've addressed a lot of the, well, what should I do now? So on behalf of vaccineangel.com, on behalf of our 25,000 members, I cannot thank you enough for the efforts, for the professional work that you're doing. And I can only pray for you and for your colleagues where you work, that you're able to keep your chins up, you're able to smile and go into the days ahead with a very positive and a vibrant attitude as you maintain today. You guys are the real angels.
Thank you, Jill.
Thank you so much.
Thank you for the work you're doing.
Thank you.
Have a good day and thank you.
Thank you.